What's up, guys? Welcome back to Total Marriage, where we talk about the total relationship experience. What are we talking about today? I am a 31-year-old male. I was raised by women my entire childhood. I've seen my aunts pregnant, my cousins pregnant, my mom pregnant. And as far as pregnancies go, the only thing that I was aware of were the physical aspects of pregnancy, gain a little bit of weight, a little bit of swollen ankles, a little hair loss, moody, and everything else like that for obvious reasons. Me being a kid, not needing to have that information just yet. The first time that I heard anything about postpartum depression, which is today's topic, I was about 22, 23 years old in the military, and my supervisor, she just had a baby. And you get the maternity leave. And I noticed that after her maternity leave was up, she never came back to work. So I got wind of something about postpartum depression. And again, not necessarily needing to know what that was at the moment. I hear the word depression, didn't think anything else about it. So fast forward to today with me having this YouTube channel. And for those of you who are trying to have a better relationship, have a better marriage, I'm constantly looking for content to give you guys. And I come back across postpartum depression again. So I look into it. And when I tell you could not have been more wrong about what postpartum depression was. Um, Having the information sooner, I probably would have been able to offer a little bit more help to other people. There's a lot of content out there of what men should be doing and what women should be doing and who brings what to the table and everything that you can possibly think of to keep us separated from each other. So what I did today was I went and found someone who was gracious enough to come up. She's an expert in the area and she specializes in postpartum depression. And she was gracious enough, like I said, to come up and help us with understanding what it is, because it doesn't just affect the mothers, it also affects families, friends, the husband, and even the child. So without further ado, let me bring her up. For everybody in the chat right now, can you guys do me a favor and type Sophie in the chat? How you doing, Sophie?
I'm good. How are you?
I'm doing well. I'm doing well. I appreciate you for coming up and talking with us today about everything. So if you could give us a little rundown on who you are and what it is you do exactly.
Sure. So, my name is Sophia Small. I am a licensed clinical social worker, and I've been working in the mental health field for about 12 years now,
Mm,
specifically providing mental health therapy for coming up on 6 years. Currently, I am working as a contracted mental health therapist for Hope and Healing Counseling in Shreveport, Louisiana. I did recently just move to California, so right now I'm just doing virtual therapy sessions for the state of Louisiana and Alabama. Um, as far as like my areas of specialization, obviously includes postpartum. I also specialize in mood disorders such as depression, bipolar disorder, anxiety disorders like OCD, generalized anxiety, phobias, PTSD and complex trauma, neurodevelopmental disorders, so things like ADHD and autism, stress management, family conflict, and couples and marital counseling.
mm,
Um, as far as my approach to therapy, just in my personal and professional experience, I found that only specializing in one type of therapy is not going to be what's most beneficial for everybody.
mm.
So I've tried really hard to get as much training and education in lots of different types of therapy as I possibly can, just so I can make sure I'm really individualizing the approach to treatment for my client. So based on their personality, what their goals are, what they're dealing with, what their learning styles, things like that. So if I were to describe it in a nutshell, I would say I have a very eclectic, integrative, holistic approach to therapy. I do have some specific trainings in EMDR therapy, CBT, DBT, but in a nutshell, that's basically what I do.
Okay. And how long did you say you were doing this for? You've been doing
Uh,
this?
Therapist, I've almost 6 years.
Okay.
Mhm.
Um, So what I have in mind is, like I said, we can have a conversation. I ask you a few questions. And for those of you who are watching, if you have any questions, if you want to come up and share your story or someone else's story, whatever the case may be, um, let me know. I'll drop the link in the chat for you guys to come up. The only requirement is to ask that you're on camera and you don't have a noisy background. So, um, my first question for you is just to kind of lay the foundation. You corrected me on this
Mhm.
whenever we were having a conversation before, because I brought up postpartum depression, but you said that it's more than just postpartum depression. So can you share with everyone what you meant by that?
Yeah. So
Mhm.
prior to getting this training, I, like you, was very much in the dark. I really only heard about postpartum depression. But we're actually now making the movement towards calling it perinatal mood and anxiety disorders. And I'll refer to
Mhm.
it as PMADS because it's a pretty lengthy
Mhm.
name. But the reason for that is because we're finding that the onset of PMADS can happen at any point between time of conception all the way up until a year after delivery. So at any
Mhm.
point in that time, um, a woman can develop postpartum depression. But so it's more than just depression. So we're also seeing different symptoms like anxiety, OCD symptoms, PTSD, even depending on if the mother experienced a traumatic childbirth or delivery.
Mhm.
And we're also seeing in some severe cases, some women do develop psychosis. So for that reason, we're moving more towards perinatal mood and anxiety disorders just to kind of cover the whole area.
I got you. Are there any groups of people who are more prone to developing postpartum depression?
Yeah, I mean, well, overall, I mean, postpartum or PMADS, it's a universal experience. It doesn't necessarily discriminate.
Mhm.
But definitely, as far as factors that we're seeing is if someone has a family history or personal history of any mental health disorders, so depression, anxiety, schizophrenia, or even in prior pregnancies, if they had PMADS, they're more likely to have it again
Mhm.
um, uh, following pregnancies. Any sort of complications or difficulties with pregnancy, history of trauma is definitely puts you at a higher risk. Also, things like physical health conditions, so thyroid diseases, diabetes, not to include gestational diabetes. There's no correlation there, but diabetes,
Mhm.
um, lack of social supports, life stressors, um, unwanted or unplanned pregnancies, things like that.
I heard that, so you can correct me if I'm wrong because I'm coming from a place of no knowledge whatsoever. I was told these two things that, like you just said, if you are already suffering from depression or like on a day to day, if you tend to be like a negative thinker or you tend to have anxiety already, you're more prone to getting, you call it PMAS. I'm gonna try to keep calling it PMAS.
Yeah.
So
Yeah.
you're more prone to PMADs if
Mhm.
you have those type of mental, I don't want to
Mental
say disorders,
mental health
mental
issues.
challenge. Okay,
Yeah.
yeah.
Mhm.
Okay. And also, can you explain what the difference between PMADs, if there is one, and baby blues, something like I think that's what it's called.
Yes.
Can you
Yeah.
explain the difference between those two?
Yeah, absolutely. So baby blues is definitely it's not as severe. It's not as it doesn't affect someone's day-to-day life as severely.
Mhm.
And baby blues, I think it's around 60 to 80% of new mothers will experience baby blues.
Mhm.
So baby blues is doesn't last nearly as long. Like the symptoms are not nearly as long. They usually
Mhm.
last for I think only like a few weeks after delivery. So it's not long term. And also, so as opposed to like with PMADs, baby blues, we're not seeing, any increased risk in actual depression symptoms. So, I mean, with hormonal changes, a mother may be maybe a little more emotional or dramatic, as
Mhm.
some people say. Um, but it's not to the extent of where the mother feels like they're a different person. A lot of times, if it's PMADS, I hear things like, I don't feel like myself, or
Mhm.
there's feelings of hopelessness, or even anhedonia, which is the inability to feel pleasure. So baby blues, it's emotional, but it's not to the point where it's affecting your ability to take care of yourself or take care of your baby.
It's a little more mild, but
Yes.
same thing, just a little bit more mild?
Yes, manageable. So yeah, I mean you still have those feelings of hope. You still are able to enjoy things that you enjoyed before. Also, as far another clear indicator is fatigue. So if you're experiencing
Mm.
PMADS, you can get all the sleep in the world. You're not going to feel rested. Whereas
I
baby
might have
blues,
PMAS myself if that's the case.
right? But with baby blues, it doesn't feel as I guess like as end of the world
Heavy?
type feeling.
Mm.
Yeah,
Okay. How is it misdiagnosed often? Because like you said, I know a new baby can obviously add stress to your life.
yeah.
So outside of it being just normal depression, I've heard the stories about, and I'd love for you to share some about women who hear voices in their head and like burning their clothes, like those severe cases where the baby is in danger, the mother's in danger, and everything else like that. So, how often is PMAS misdiagnosed?
I don't know if we have an exact number, but it's definitely underreported.
Mm.
So statistically, I think it's one I think 1 in every 5 to 7 women will develop PMADS. And I think it's 1 to every 1,000 deliveries they will develop psychosis.
Oh
So that's
wow.
like actual like hallucinations and
Mhm.
delusions and things like that.
Oh, wow. So if you think about, I think I saw some numbers about 3 point something million babies in the United States or something like that. So that would be, my math isn't great, but about
Yeah.
900. You know what? It's a lot of people.
A lot of people. Yeah.
Yeah, it's a lot of people. Um, so if someone were to come to your office, well, first of all, who would they come to first if they had an issue or they thought that they might have an issue? Would they come to you first or would they go to the doctor or which doctor?
So there's kind of like this assumption that the OBGYN is going to be the one that's screening for PMADs.
Mhm.
And unfortunately, what we're seeing is that a lot of OBGYNs don't feel qualified to screen for that.
Hmm.
And so often, I mean, I have yet to get a single referral from an OBGYN for PMADs. It's usually the mother or the father themselves coming and requesting help.
So I'm assuming that they would probably come to you first and then they would go back to the OB to get whatever, if any, medications or something like that.
Mhm.
So they get referrals from you, but you don't get any from them.
I have not gotten any. No.
Do, do you have any like case studies or anything that you've experienced since you severe, the worst, the best, whatever the case may be? Case stories, case studies.
I have not. I feel I don't know if fortunate is the right word, but I have not had a client who's experienced the severe like psychosis
Hmm.
degree of PMADS. I know that I've heard that it's definitely real. A case study that was presented at one of the trainings that I went to. So the thing with psychosis is there is a difference between intrusive thoughts and having psychosis. So
Hmm.
another common symptom of PMADs are maybe intrusive thoughts, or they'll look like OCD type symptoms. So that's when the mother is continuously afraid that the baby's going to be harmed in some way, whether it's accidentally by them or someone else. But
Hmm.
it's an intrusive thought because the mother often knows that it's an irrational thought. They know that it's not likely. They know the possibility is slim to none. Whereas psychosis, um, the person truly believes that whatever this delusion is, whether that the baby's possessed by a demon, or I heard of one case where a mother had the delusion that there were social worker ninjas that were going to come and kidnap her baby.
Mm.
And she fully 100% believed this was true. So often it usually has to do with the mother being worried that harm will come to the baby.
Hmm. So I know you talked about your approach. Do you ever take a religious approach to it, or is your approach usually pretty much the same for each patient?
No, so again, it goes back to the individual. So that is part of the assessment process that I do. I want to make sure that I am catering my approach based on what my client is needing and meeting them where they are. So I do ask questions like, are you spiritual and religious? How important is that for you in your daily life? Is that something that you want me to incorporate into our therapeutic process? So I really leave that up to my client. And I
Hmm.
try to be very transparent. While this is my area of expertise, I don't have all the answers. So I
Hmm.
really try not to ever make any assumptions about someone's religious beliefs. I make sure that I ask questions, and I make sure I'm gaining a really good understanding of where they are and how that plays into their daily life.
Okay. As far as treatment goes, what I know that this will obviously be a case by case thing, but overall, for someone who's struggling with it on a pretty common level, what treatment routes would you take with someone who has postpartum PMAS? I'm sorry, PMAS.
It's fine. Um, I guess it depends on the assessment, just because it is different from person to person. Just like 'cause the only thing that separates PMADS from any other mental health disorder is that PMADS, the onset happens during the perinatal period. So
Hmm.
that's really the only thing that differentiates the two. And I guess also it does present a little differently because a lot of times it's surrounding the birth of a child. And so a lot of times a child is kind of incorporated into those symptoms somehow.
Hmm.
But I want to do a very thorough assessment to figure out, is this anxiety related? Is this depression related? Are you having intrusive thoughts? Um, I also want to assess any trauma history. A lot of times, when you go through a big major life change, unresolved trauma may pop back up, and so
Hmm.
it sometimes we have to go back to their childhood and address their childhood and take more of a trauma informed approach to that treatment.
Hmm.
um, for some mothers it's more skill based, so they just need coping skills. How do I manage my anxiety and my depression? So it really, there's no, I guess, straightforward answer. It
Cookie
really.
cutter way of answering that.
Mhm.
Mm. How long if someone is diagnosed with PMAS, how long does that typically last for?
If someone's diagnosed.
Hmm. If they're diagnosed, because well, and again, this is just from my knowledge.
Yeah.
I was under the impression that once you are diagnosed, it's something that lasts for a certain period of time, and then you kind of come back to yourself again. Is
Mhm.
there a time frame for that, roughly, or is it just?
Depends from person to person.
Mm.
I have not seen any like statistical information showing a time frame.
Mhm.
I think a lot of it is dependent on that person's support system, their access to medical care. Um, yeah, it really just kind of varies, and also their readiness for change.
Mhm.
A lot of times in therapy, I will encounter resistance with my clients. And
Mhm.
so we may need to kind of sidestep a little bit to continue building the relationship and trust between myself and the client in order to get back on track and continue.
Okay. So with that, that brings up another question that I have. If there isn't a set amount of time on how long someone could be dealing with that, have you seen any issues with the raising of the child, with the mother being in that? How does that affect the child?
It affects the child greatly, because your caregivers. I mean, that is your foundation for your life. Your parents are, or your caregivers, They're the ones that are, it's not just about taking care of the child's physical needs, but also their emotional needs. And I'm actually seeing a lot of that in my practice right now. I have a lot of clients whose emotional needs were not met by their parents for one reason or another.
Mhm.
And so it does increase that child's likelihood of developing anxiety disorders or depression disorders
Mhm.
if their parent is not able to nurture and be emotionally present and connect with their child.
Mhm. And what about the father? If the father is in the picture and he's part of it, how have you seen that affect marriages?
Definitely can destroy a marriage. I've seen a lot of couples come in and they think that having a child was going to resolve the issue, and surprise, it made it so much more
Yes,
complicated.
indeed.
Yeah, and also another statistically, what we found is that if a mother is to develop PMADs, it does increase the risk of the father to develop some form of depression, regardless of whether they had a prior history of mental health issues or not. It does put them at a higher risk for developing it as well.
And when you say developing it, you mean just obviously it's not anything hormonal. It would
Mhm.
be just as a result of dealing with the mother.
Yeah, dealing with your, like, if if your partner is not able, or if your partner is struggling, there are a lot of different factors that would then affect their partner, whether that's like the financial stress.
Mhm.
Often mom's on maternity leave, so the
Mhm.
finances are up to their partner. Also, lack of support system, just different things like that, and anxiety, not knowing, what's going to happen, the I guess the fear of the unknown.
So what could the father do in those moments to help? I'll I'll tell you what I've gathered from my limited study. Um, I was told that if the mother is dealing with any of those issues, getting her out of the house or putting her around other people and getting her socially, like getting her back social with her friends and everything else, because a lot of times that I've heard people say that they just want to get in the closet and cry.
Hmm.
They don't want to be around people, like all of the signs and symptoms of depression.
Hmm.
So, in those moments, for fathers who might not necessarily know how to handle that situation, what would you recommend for a father to do to be a good support?
I would say they need to get their own support first, because I mean,
Hmm.
they don't have training on how to deal or manage
Hmm.
or help someone with depression or any other mental health disorder. So I wouldn't expect them to necessarily know. And it's also, to a certain extent, it's not, I don't want to say not necessarily their job. It is their job. You want to be supportive, but it's not their responsibility, I guess, to cure their partner, because they don't have the skill set to do that. And also, there's a relationship there, so that it's just not possible to cure your partner. So I would say
Hmm.
the most beneficial thing that a partner could do is seek help from a professional, whether that's a counselor, a therapist, and doing their own research about PMADs, to gain understanding to what their partner might be experiencing.
Okay. So if you were to take your hat off, you're just Sophia Small, just working at Starbucks, doing whatever. You have the knowledge, but you don't have the credentials and everything else like that. If someone that you knew, if they were struggling with that, what would you recommend they like? Give you a trying to make the question a little bit more specific. There's a lady just had a baby. She's struggling or dealing with PMAS, and she's sharing all of this with you.
Mhm.
But she has this idea in her head that it's not that big of a deal. It's not this, and the third, because there's this crazy stigma around mental health and getting therapy. What would you recommend that person do to kind of baby step them into the direction of getting help?
Mhm. I
If that
think
makes sense.
the
Okay.
most important thing, because a lot of that stigma is based in shame.
Hmm.
And so, and when someone holds shame, I mean, the way I define shame is, if you hold shame, that means that you believe that you as a person are not worthy. And so, if that's your core belief, if your core belief is that you are not worthy or that you are defective or something's wrong with you, um, it's going to be really hard to get help and to, recover and heal. So, uh, I don't know if you've heard of Brene Brown, but she's an amazing, I think she's a social worker and she does a lot of research around guilt and shame. And her approach is, to put it out there in the light. So if someone can sit with you in that darkness, you're reducing that shame because you're exposing it to the light. You're not keeping it in the dark. And shame cannot
Hmm.
exist if we're exposing it, if we're talking about it. So I would say, as far as if someone came to me and told me that they're experiencing those things, I would try to validate their experience. I think a lot of people are afraid to say out loud that, hey, it sounds like you're struggling, but you have to say it. Just say it out
Hmm.
loud because that validates that experience for that person. This isn't normal.
Hmm.
You need help.
So I'm assuming that you wouldn't recommend doing like a intervention level of like all of your family and friends sitting on the couch and you're like, hey, let's come over and grab a coffee, and you wouldn't go that route.
Probably not. I have not
Hmm.
really seen interventions be particularly helpful,
Hmm.
especially because if someone's coming to me because they've had some sort of intervention, they're not necessarily ready for that change yet. You can lead a horse to water, but you can't make them drink.
Hmm.
So interventions, no, I would say the best way to approach it is, how can I show this person love and support while they're struggling?
Hmm. So if someone is comfortable enough opening up to you, just, I mean, I guess that would be on the person that they're opening up to kind of know how to handle it, because everyone doesn't know how to handle someone's emotions like that.
Yeah, yeah,
Some
I
people
think
are just like, "Oh, that sucks," and it just kind of doubles down and makes that person go off a little bit further. But so pretty much, if they're honest and open enough to talk with you about it, stay where they are with them and validate them and everything else like that.
hmm and don't be afraid to ask what they need. I think a lot of people are afraid to ask someone who's struggling what they're needing from them, but asking like,
Hmm.
"Hey, what can I do to be a support? Do you need me to just listen? Do you need me to give you advice? What do you need?" So never be afraid to ask what that person is needing.
Okay. Um, is there anything that you feel as though is important around this topic to share with the people watching that we
Um,
haven't discussed? Or if we have discussed it already, the most important thing, in your opinion, to take away from it if they come across someone who's dealing with it or dealing with it themselves?
uh, I would say I guess, because of the stigma around PMADs and, just like you said, mental health in general,
Hmm.
um, just talking about it more in a non-judgmental and non-critical or confrontational way. Yeah, I think that's
Okay.
not
Are there
necessarily.
any like groups or resources that are, I know, I'm sure there are a million Facebook groups out there, but is there anything that is a little bit more professional or a little bit more accredited that you're aware of, like that someone could, oh, go ahead. I'm sorry.
Yeah, yeah, no. So
Hmm.
I got my training through the or no post. Ironically, it's still called Postpartum Support International. But
Hmm.
Postpartum Support International, you can go to their website. It's postpartum. I think it's called postpartum.net. And so through that website, you can actually find providers who have, and that's including mental health as well as OBGYNs who've received this specialized training. So
Hmm.
they have a little more knowledge about PMAD specifically. And they have lots of different resources on there. They have, suggestions for like readings, reliable, because that's one thing I really encourage people. Make sure that you're going to a reliable source Don't just
Mhm.
rely on Reddit or
Yeah.
TikTok. Please check your sources, make sure they're reliable and they're valid. Um,
Mhm.
but I would say that's kind of Postpartum Support International has done a really amazing job at kind of getting all of those resources in one place. And so they have lots of different recommendations and additional readings or support groups that you can go to.
Okay. And I know you mentioned this before. Just because you have signs and symptoms of PMAS doesn't necessarily mean you're going to be diagnosed with it, correct?
That's a
Because
complicated
I
question.
I don't want it to come across as though when you have your baby, as stressful as they are, you're losing sleep or you're tired or you all of the common things that you would get from it for someone who might be on edge about most things to assume that, oh, I'm depressed or I'm unhappy a lot, that I might have postpartum, and it kind of causes them to spiral into it.
Mhm.
Does that make sense?
Yeah, yeah. So I feel as far as like my approach to diagnosing in general,
Hmm.
um, well, I think obviously diagnoses are important because for some people it does give some clarity. It reduces that
Hmm.
feeling of loneliness. Like I'm not the
Hmm.
only person experiencing this. It also kind of has the opposite effect or can have the opposite effect of making that person feel boxed in or be defined by their diagnosis.
Hmm.
Um, and I think different providers have different approaches to the diagnosing process.
Hmm.
Also, you want to take into consideration, unfortunately, with insurance, depending on what your diagnosis is, that goes to insurance, and that may affect your insurance coverage. So,
Hmm.
I personally try to be very, very, very careful about diagnosing anyone with anything, just because of that stigma and bias. Uh, so I guess to answer, it really just it depends. I would do research on the provider. I guess if you're concerned about
Okay.
the diagnosis, I would do research on the provider that you're going to.
Hmm.
Sometimes you can tell if a therapist is very heavy on diagnosing versus
Talking
addressing,
to you.
yeah, and
Yeah.
addressing the issue. So my personal approach, I usually try to keep it as like the least invasive, I guess, diagnosis, which is
Hmm.
typically adjustment disorder with depression or anxiety symptoms.
Hmm.
Um, but there are, obviously there are some cases where we need to have a diagnosis, especially if, the client would benefit from medication. In that
Hmm.
case, we would look more so into the diagnosis piece. But I do encourage those people who are hesitant or weary about the label of a diagnosis, have that conversation with your provider and your therapist. Be very
Hmm.
honest about that concern and ask those questions, make them aware.
Hmm. Okay. And my last question for you. I know you said that one in every 1,000 women will be diagnosed with psychosis, and you said one in every 7 or 8 women would be diagnosed with PMAS.
5 to 7, one in every 5 to 7.
Okay, one in every 5 to 7. So
Mhm.
based on the middle ground of the issue, how big of a concern would you say it is for women to be worried about whether or not they're going to get it and be able to manage and deal with it? Middle
Mm.
ground.
Mhm.
Obviously, the extremes are the cases that they are, and then the mild cases. But just on average, just from what you've seen.
I, I I don't know if the word concerned is the right word. I
Okay.
think it's important to be very vigilant and aware. So I would say self
Hmm.
awareness is key.
Okay.
If you start feeling not like yourself and you start noticing that you are having issues functioning on a day to day basis, um, it's time to ask for help.
Okay. Well, Sophia, are there any disclaimers? I know in the medical field, there's always these disclaimers, whether it's medical or lawyers and everything else about I am not your whatever. Is there anything that you want to share, or is everything that you pretty much gave basic information and you're not worried about any type of issues with that?
Well, I will. I guess I'll say that just because this is kind of my as far as like how I approach treatment. Every
Hmm.
therapist is going to be different.
Hmm.
I do think it's like I said a little bit earlier. It's incredibly important for you to make sure that whatever therapist or clinician you go to is going to be the right fit. Because not every therapist and their approach or their personality is going to be the right fit for you. So don't be afraid to interview your therapist and ask them questions about their approach, ask them
Hmm.
questions about how they, what to expect from treatment, just so you have that understanding. Um, but definitely, I would say making sure that you are asking questions from everyone on your treatment team. So that includes your OBGYN, that includes your support system, so family, friends, your partner, mental health providers, lactation consultants, doulas. Don't be afraid to advocate for yourself and ask questions to make sure that whatever course of treatment you choose is
Hmm.
what's right for you. And follow that gut instinct as far as what you think is going to be most beneficial and supportive for you.
Okay. And do you have any links or websites or socials, or you would like for people if they had any questions to reach out to you, or you?
Sure. Yeah. So
Okay.
like I said, as far as finding more resources and also finding providers maybe in your area that have this specific training
Hmm.
about PMADs, that is postpartum.net. And then I am always happy to answer more questions. I will say that it is really hard to just because everyone is so unique and every case is so unique and individualized. It is hard for me to kind of answer generalized questions because it is so specific to the person and their
Hmm.
experience. So I'm more than happy to answer questions, or if anyone is interested or needing therapy, or want to have I do free consultation calls, and a lot of therapists do free
Hmm.
consultation calls. You can do a 15-minute phone call or video call with a therapist just to kind of ask questions and get a feel for their approach. I'm more than happy to do that. Probably the best way to contact me would be through the Hope and Healing website. So let's get that website up. I should know it by heart, but
Let me
I don't.
see. Uh, hopehealingcounseling.com.
I think that's what it, yes, hopehealingcounseling.com. Um, and under there, it has like the AI chat virtual assistant person on there. So if they want to contact me, they can request for my contact information through that.
Okay. Sounds good. Well, Sophia, I really do appreciate your time. We didn't get a whole lot of questions this time. Like I said, usually there's about 15, 20 people, but the video will be shared. So if someone does have any questions, I'll again leave the link in any type of comments or whatever I need to do to get them in your direction.
Sounds
So
good.
I appreciate your time. And if no one has any other questions, thank you guys for watching.
Thank you.